wants to kind of having a conversation here and getting everyone kind of up to speed on how Spark can enable you as a Medicare agent working with LBA to grow your business faster, better, stronger than it is today. And you can obviously reach out to us with any support requests needed on the contracting or the platform side. And we'll obviously be here to help. And so, Charlie, maybe a quick introduction for you, and then Ed, we'll let you kind of take the reins.
Hey all, I'm the agency growth lead over here at Spark. You won't see much of me, but I'm working on the back end to make sure that Sam, Ed are all kind of in sync with Gabriel and the broader team at LBA. So yeah, really excited to be here. And I'll turn it over to Ed.
Hey everyone, my name is Ed. I am on the agent success team here at Spark. So I will be your person, one of the people you'll turn to if you'd like to talk about the platform, some of our features. You're going to see me in a lot of our training materials or videos. You'll be very familiar with this face eventually, but I'm really excited to see all of you today and start giving you a preview of what the Spark platform is going to do for you in your day-to-day. So thanks for joining us. I also have my colleague and lead for my team, John, on the call here with us. Want to say hi, John?
Hey, everyone. I'm going to be partnering with Ed today on the call, presenting some workflows with you guys on the Spark platform. So for those of you that maybe are less familiar, some of you, I think we've begun to work with on Spark. We've built in a one-stop shop Medicare platform for you to run your daily business, and it's available to all agents through LBA. And so we're going to go through, Ed's going to take you guys through some workflows on that platform. Essentially, we're going to show you guys how you can add in contacts and then go through some of our pre-enrollment and quote and enroll flows. So Ed's going to be doing a demonstration, but I'm also going to be answering questions in the chat as we go through. And we'll have some follow-up links with like some other trainings and additional pieces to what we're showing you guys today after the call.
Excellent. All right. Thank you, John. Well, without further ado, I am going to share my screen and we can start jumping into the platform here. All right. Can you all see the Spark platform there?
Looks good.
All right. Well, here we are signed into the Spark platform, and this is our homepage. So you'll see all these different tools here laying out for you, but just kind of starting from the beginning of working with a prospect and getting them into your Spark account. So I want to show you first how we can enter that client data. And to do that, I'm going to come to the left toolbar here. We have different tools, but I'm going to go to contacts here specifically. Now, we have other options on uploading data files with client data, but we can also add individual contacts. Oh, let me back up there. That I want to point out. So I came to contacts here in the left toolbar, and we have this button in the upper right corner, add contact, cleverly labeled. So we can just start adding client information here. Today, we'll do Betty Crocker. And then we'll just kind of quickly enter her basic info, date of birth. We do have language preference. I'm going to just leave that as English. We'll need at least one piece of contact information. I'm going to enter just this email for now. We can also add spouse information, address, Medicare info, other points of contact. Right now, I'm just going to at least get this basic info entered. We do have the minimal amount there, and we'll click on Add Contact. After that, I have Betty sitting here in my Spark account ready for some follow-up. And I can see at this point, the status of Betty. It says needs analysis. This status is worked into this platform to kind of guide you through suggested next steps as you're working with prospect through enrollment and beyond. So next, needs analysis is essentially telling us we have Betty's information, but contact information, but we need much more information in order to start looking at the right plans, what's going to work best for her. So with that, we have what we have called a needs assessment, an electronic information gathering form on a lot of Betty's medical needs. So to show you the needs assessment, this is one of my favorite features because it will take a lot of the data entry time off your hands and let the platform do it for you. So we have this box here that also says needs analysis, and we see our suggested next action, which then says send needs assessment. So to do that, I can click on the button continue here to send this form to Betty, or we have this little down arrow in the upper right corner. There are several different options there. We'll go over a couple of these here, but send needs assessment is one of those there as well. For this example, I'm just going to use this box here, click on continue. Here we can select the language of the email. We have English and Spanish. The email address will auto-populate, but you can alter that if you need to. You also have a choice. I'll show you the templated email that Betty's going to receive here. But if you'd like to make something more personalized, you do have the option to create a link. And you can just copy that right to your clipboard and paste that into an email, use it as a hyperlink, send it as a text message, any of those options if you want to do something more personalized. I'll show you why that might be an option you're interested in when we take a look at the email Betty receives. So to send, I have email contact, and then I'll just click on the blue button that says send needs assessment. I see a confirmation message telling me that it's on the way. Now let me just bring up Betty's email here. One sec. Betty is going to see your name as the sender. Sunny Firestone is the name of our pretend agent we have made up here in our demo account, but your beneficiary will see your name as the sender. And we see a Medicare information request. Now we go into the email. It says, "Hi, Betty. In order to properly assess your latest needs, please fill out this form to the best of your ability. All responses are confidential." And there's a link to the form. And at the bottom, we will see your name and your phone number listed. Now, this email will look exactly like this. We do not have a way to make it more personalized beyond the name and phone number. So that's why creating that link might be an option if you wanted to do something a little more personalized for Betty here. But let's take a look at this form. I'm just going to click on Start Form, and we'll kind of walk through this together to see all the details that this is going to gather. We will start the survey, and Betty's going to need to authenticate some personal information. So we will get her date of birth. Oops, I'm sorry. I think I did 55. Yes. See, she did not enter the right date of birth, so she cannot go any further. But now we have her ID authenticated, so we can collect that personal information. We'll go through each section together, starting with personal info. We already have the date of birth saved, so we can just continue. And on the next page, we can get more contact information. One of my favorite things about this form, though, is it will update existing information you already have saved. So notice the email address is already filled here, but Betty's like, I have this different email address that would work better. She can just alter that email address on this form, and this will update the platform automatically. We'll add a phone number. Hey, John, help me out a sec. I always forget the office address.
You just want to you can do 212 Broadway.
212, thank you.
And then just make sure we're in New York.
Yep. There we go. Next, we'll ask for Medicare information, exactly how it appears on the card. So I'm just going to plug in some made-up information here for Betty and some made-up Part A and Part B dates. Then we'll go to benefits and utilization. If Betty has any current plans, she can enter that information here just by typing it in. Then we'll ask about benefits of interest. We have a number listed here of things that might be more important to different clients. I'm just going to select the top 3 here. We'll ask about veteran status and other supporting information such as Medicaid, LIS, Social Security. We'll also ask about travel frequency, just in case maybe they need international coverage. Then we'll collect information on their prescriptions. We have this button to add medication, which will take us to a database. We can just start typing in the name of the prescription, select it from the drop-down list. We'll indicate the dosage. I have no idea if this is a correct dosage for someone, but we will add that here. And then they can just keep adding all the prescriptions, and once they're all listed, we'll continue to the next section, which is to add the local pharmacy. Now, when I click on the Add Pharmacy button, it's going to auto-populate here with Betty's zip code, whatever we have saved in the platform. You can change this, though. This will search for pharmacies around that zip code, but if she goes a little out of her way, you can alter that zip code. And then we can type in the name of the pharmacy, and it will pull a list of all the pharmacies around that zip code. But one of the great things about this database, it's not just going to pull up the big brand names, it's also going to look up those small mom and pop drugstores as well. We'll say Betty goes to this Ace Drug. We also have a space just in case she prefers using a mail order pharmacy instead. And the last section is provider information. So here we will ask for first the primary care physician, and this works very similarly to the pharmacy database. So zip code is already populated. We can type in the physician's name, do a search, and just select them from our list that pops up here. I'll just pick one here. Let's see. Well, Gary will do here. Then we can add specialists too, not just the PCP, but we can also look up any specialist in the area. Again, we can change the zip code if we'd like. Then we can just select the person from the list and keep adding them until all the physicians are listed. Once we're done there, we'll click on continue, and Betty has reached the end of the form. She can go back, click on these links if she'd like to edit any information, but she knew what she was doing this time. We're going to say everything is good to go. We'll click on the button here, yes, submit my survey. Betty will get a confirmation message. She'll have the option to print off her results as well if she'd like. But if I come back to the Spark platform here, I'm back in Betty's contact. I'm just going to refresh this page. And if I scroll down, a couple things I want to point out. First, we have the contact history tab here. This will keep record of different actions you have used the platform to take. So we see that we had sent a needs assessment to Betty. We can see that she started the needs assessment, and we can see that she's completed the needs assessment. I can click on the link here to take a look at her results this way. I can print this off myself. I can save this to my own device, but we will keep this retained in your account for you as well. And it's not just documented here using that link. We have another tab here that says information and needs. If I click there, we can see all that information Betty provided to us has been saved. I can also see here with her contact details, that email address is automatically updated with that updated address she provided. So this is a great way. I know a lot of people, a lot of your beneficiaries may have a long list of providers, long list of prescriptions. Sometimes it is multiple phone calls. So this is a great way to save yourself time and let your beneficiary work at their own pace to provide this information. Now, we do have information we need to start really looking at the plans that are going to work best for Betty. And we want to have that meeting to have the talk. But before we can do that, we have the ever important scope of appointment that we would need to send. So again, remember, we have this little down arrow in the upper right corner here in the contact with different options. We have created a electronic scope of appointment form. A lot of agents were using paper forms or maybe third-party e-signatures. So we made a much more streamlined process here for y'all. If I select Sign SOA as an option, I'll see the layout before we send this to Betty. At the top will be her contact, including contact information, including address. Now, if you don't have an address saved, you will see a message here in red telling you you won't be able to send the scope. You're missing some information. I just want to point that out. This is a requirement by CMS to have contact info. So if you see that message, back out, get that added, and then you'll be able to send the scope. But then we have a list of different products here we can discuss. We can check off all of them, any amount of them. We deselect. Again, we can select a language, English or Spanish. Then we have different options on signing. First thing I tell everyone is, regardless of which method you're using, make sure you update the date here for when you're actually meeting. Then we have the option to sign in person or to send this scope of appointment. If we send it, we have the option to just send it as an email, very similarly to what we saw previously. You can also create the link through, if you'd like to do something more personalized. And you also have the option to send to an authorized representative, just in case Betty is working with maybe a family member or an attorney, power of attorney, we can get that form to them as well. So I'm going to show you this option to send it as an email, but also point out we do have the option to sign in person. This is perfect for those of you maybe meeting in someone's kitchen, and you can just slide your device over and Betty can sign the form right there. So that is always an option. Great for those walk-in appointments that just kind of stumble into your life as well. But let's take a look at this form and what the email will look like for Betty. I'll just click on Save and Send SOA. If I hop back into Betty's email, I see Sunny has sent a scope of appointment for Betty to sign. We'll go in. Once again, we do not have a way to make this more personalized, but we do still have that option to create a link. But if I click here, we see the scope of appointment, and we're going to click on the button to get started here. Once again, Betty will need to authenticate her ID. And once we do that, we are in our scope of appointment. Everything here has been reviewed for compliance, so you are good to go. We have all those products listed here again on the form. Underneath, we have everything listed again with definitions, more information. Another great thing about the form, Betty can say, you know what, I actually do need to talk about dental, vision, and hearing. She can have the option to click that, so we are updating the scope of appointment. And maybe she says, I don't want to talk about med sups. She can check anything she wants there. And then signing is just a matter of typing in the name. We'll click on sign. We get a confirmation message. Betty can print or save that form if she'd like. If I come back to the contact, I'll refresh. And down here in my contact history, I see we have that signed scope of appointment. And again, I can print it off. I can save it myself. As we know, you do need to keep that on file for at least 10 years, and we will do that for you. So that scope will be retained in Betty's contact here. Now, as you take more actions, you'll see more things logged here in the contact history. The scope of appointment will start to move down that list. But if you want to get to it quickly, we have the Quote and Enroll tab here. We're going to start using this a little more closely for our next example. So when I click on this link, I can see right here the most recent scope of appointment. I can click there if I'd like to take a look at it, but that will be your fastest way to see the most recent scope. But this is a great segue into looking at our Sunfire tool that's going to help compare and enroll your beneficiaries into the right plan. So here, staying in this Quote and Enroll tab, I first see this checklist. This is simply a visual aid. We have all these different items checked off. This is only going to help you get a more accurate quote. But if you don't have any piece of information, you'll see a red X. It's not going to stop you from taking further actions. Again, just a visual aid on information you may want to gather. But at this point, I have a snapshot of Betty's health needs. I have the signed scope of appointment. So let's take a look at plans. And to do that, we will launch our Sunfire tool by clicking on this button cleverly labeled Launch Sunfire. So we'll click there and then we'll continue to Sunfire. We'll see a new window pop up and Sunfire will start to load up for us here. One sec, sometimes my little demo account needs a moment to let the coffee kick in. There we go. So we can see different plans pulled up here in Sunfire. Now, Sunfire essentially is a tool to look at different plans, do comparisons, and enroll folks into the right plan. This is essentially going to be your meeting place for those carrier contracts you're appointed to sell through Spark. So we can see that we have different filters here with different carriers. We can use the filters here on the left to look at different types of plans. This will default to MAPD, but let's say you just want to look at strictly Medicare Advantage, you can look at those. Maybe DSNPs. We have the special needs filter here as well. So lots of different ways to narrow that scope. But one thing I really want to point out here is when we pull up Sunfire, we see all these different plans laid out for us. We get a preview of information. This is all organized based off of information we have saved already on Betty. So this is prioritized based off that information. If I look at the very top here, the platform carried over that pharmacy, physician, doctor information over to this form for us, saving us that little bit of information. So we see the different star ratings here. This will be our indication of how these were sorted through our priorities here. But this is just a little bit of information that we have on Betty. I'd actually like to enter more information into this tool to only help me get a more accurate quote. And to do that, we have this little icon in the left toolbar here, little head and shoulders for customer profile. I'm going to click there and we can start adding more details. We'll go through this together. First, we have this tool to look up Medicare information. So we can see the zip code carried over. If we have real information, we can use this to look up different details such as, is Betty currently enrolled? What are her dates for A and B? Is she eligible for Medicaid? Does she have LIS? And at what level does she have LIS? We won't be able to use this as an actual example since I'm working with pretend information. But if you do want to use this tool, you just check the box here. And then you'll be asked if you'd like to update your session and you'll want to select yes. Again, nothing's going to pop up here. I don't have real details to use, but then you would normally just click on this lookup button in blue. But if we keep scrolling down, we'll see which plans would we like to discuss. All the different plan types are going to be selected here by default, but I can narrow that scope by selecting, deselecting different things. We can see as I do that, different questions will populate or leave the screen here. So for the sake of the demonstration, so we can see everything, I'm just going to leave all these selected. Then we'll ask, are you currently enrolled in a Medicare Advantage or prescription drug plan? If they say yes, we can just enter that plan information here. Then we have Medicaid eligibility. This is a tool where we can look up exactly that. Is Betty eligible for Medicaid? We can look that up by Social Security number or Medicaid number. We won't be able to use this tool again. And in fact, this tool is only available in certain states. We do have a resource that has a list of those states. If you are trying to look up someone in one of the states that is not covered, you'll see this highlighted in orange. And for those cases, you'll just need to reach out to the state Medicaid office for any details. Next, we have doctor information. We can type in a physician here and add them to the quote here if we'd like, but we can see doctors were carried over. You may see doctors listed more than once. That's going to be perfectly fine. Some of them have more than one location registered, and that does tend to pop up on the form here. Then we have the required disclosures. If you ask this question, you will want to read this verbatim to your beneficiary. The next question helps me estimate cost and won't affect your plan premium. This gives me a better picture of how much the plan could cost you, but you don't need to answer if you aren't comfortable. Then we'll ask, how frequently do you see a doctor or use medical benefits? Then we can select the appropriate option here, rarely, occasionally, or frequently. We can see as we change those options, we have estimates here on hospital visits, home health care visits, emergency room visits, inpatient admissions. So lots of, or a few different estimates. So whatever your beneficiary tells you where they feel they fall in that range, we can select that. Now, they do not have to answer this question, or if they don't know, you can leave that as unknown. I do want to call this part out, just kind of put a little bookmark in your brain. I'm going to refer back to this later, and I am going to leave this as rarely as we continue here. Next, we can add pharmacy. Again, I can just, or medications and pharmacy. So we can see that prescription carried over. I can go in and edit the dosage or frequency. I can add medications here as well. Then we'll ask, do you have pharmacy information? This selected yes, and already populated with that ACE drugstore we selected earlier on the needs assessment. Then we'll ask, do you receive LIS? If they say yes, you'll see different tiers pop up, and you can ask which tier of low income subsidy they receive and select appropriate. If they're not sure which tier they are, feel free to throw out these dollar ranges at them. If they say it's only like $2 or $3 a month that I pay, you will know that it will be this middle tier. If they're like, it's like 9 or 10, you can use that to select the appropriate answer. Then we have focus questions. There are some benefits, some things that are going to be higher priority for certain beneficiaries. So we have a number of them listed here. You can select up to 3. So let's say Betty tells you transportation. I absolutely have to have that included in my plan. Just it's a thing I must have. We can select that, and this will be factored in when we run our new search here for the best plans for Betty. The next section is for hospital indemnity and Medicare supplement. We do not utilize this in our Spark platform here. To enroll or get thorough details on any of these med sup plans, you can go to, for enrollment, certainly go to the carrier portal to do those enrollments. They're going to have also much more thorough information on those med sup plans. We do have an integrated tool here if you'd like to look at different, get more details on a med sup plan. Back in the platform here, I'm still in the quote and enroll tab. And then we do have the option to view med sup options. I can click there, and this is going to pull up one of our partner tools. So we can look at those plans a little more closely. This is a CSG quoting tool we have with Pinnacle. So I'm going to come over here to Medicare Supplement, click on Run Quote, make sure I have the zip code entered, and then I can run a little search here and get the quote. And here I can I can click on the quote options here in the screen and view plan details. This is going to give you much more information than Sunfire will on specifically med sup plans. So just want to make sure you have easy access to this site. Again, you can just come to the quote and enroll and click on View Med Sup Options. Your carrier portals are also going to be a great tool looking at those plans. Coming back to the Sunfire tool here, scrolling down, I see that I am at the end of this list. We have more information added on Betty, so I'm going to view all plans. This is going to factor in all that new information I added and reprioritize which plans are going to work best for Betty. So I can see everything is popped up here with everything else factored in. We have everything listed here, all stacked on top of each other. We do have a way to view what we call X-ray view, where they're stacked on the left and you can see the details on the right panel here. But to show you more here, notice that we have the sorting option in the drop-down box at the top here. It's sorted by recommended plans, again, based off of the information we have saved. Maybe Betty says, estimated drug cost is actually a big important factor for me. We can select that and the plans will be reprioritized. We can also adjust our time period. We know that not everyone's starting a plan on January 1st, so we can also select the specific month and we can see everything will load up here. It'll adjust the premiums that we see. So you can get a much more accurate quote based on when the effective date will hit your client there. So at this point, I have different plans loaded up here. I can click on the button here for details if I want to look at an individual plan. But one of the great things is we have these little checkbox in each of these plans, so we can do side-by-side comparisons. I'm just going to select this Humana one on top and this Aetna one here. You can select up to 3 at a time to compare. I'm just going to select a couple and then click on the button to compare. We'll see the comparisons load up here. And then we have all the plan details listed here, laid out in this gray and white grid, so it's easier to read. Now, if we scroll through, we can see tons of detail plan on the coverage. 1 second, I'm going to try to not give you vertigo. I'm scrolling all the way to the bottom. But at the bottom, we have links to plan documents such as summary of benefits, evidence of coverage, and star ratings. You can download these if you'd like any of those documents in language. They will be listed here as well for both of the plans. Scrolling back up to the top, sorry about the dizzy spell. If you're working with your client, maybe in a side-by-side meeting there at the kitchen table, you can start enrolling here as well. We'll take a look at enrollment in a moment. But we have the benefit details here. We have different tabs on the top with different information. So when you first look at the comparison, you'll see benefits details selected. We also have a tab for drug cost details. So there we can see exactly that. Concentrating on just the prescriptions, we'll see Betty's prescriptions listed here. Then we'll scroll down and we'll see details by month. I see right now there's no information. That's because I adjusted that other filter showing that Betty's going to start her plan in September. So if I come down to September, that's when I start seeing some of that information being reflected to us. Now, if there are any gap coverages here, you'll see that listed in the month where the gap coverage happens. I don't have an example of that, but I just want to let you know that will be reflected here as you look at the comparisons. Now, remember, I had you all put in that mental bookmark. We asked that question, how frequently do you see doctors, et cetera, et cetera. We left that as rarely. If you leave that as unknown, you will not have this tab here for health cost details. But since we do have an idea of those frequencies of visits, we do have some more information for health cost details. We can click there to see the side-by-side comparison between these two plans. Now, if I come back to plans here, I also have an option to email this to Betty. She can receive a view of exactly what we just looked at. So I'm going to type in her name and email address. Notice her date of birth was already populated here, and we have this PIN that's listed. This time, when we send this to Betty, she will need to authenticate her date of birth, but she's also going to need this PIN. Now, you'll want to relay this to her, call her, send her an email, text, whatever you'd like to do. Betty will absolutely need that PIN. I'm going to show you a pro tip. I just copied this PIN number. I'm going to jump back to Betty's contact here. If I come back to contact history, I have this button to add a note. I'm just going to save that PIN right here, just in case Betty loses it. Then I have easy access to get that back to her. Now, if you don't save this as a note, we do have a whole other way to get it, so don't worry. You can retrieve that information, but this is just a nice, fast, easy way to go into Betty's contact here and find that PIN. So we've given the PIN to Betty. I'm going to send the email to her. And then once she opens the email, she can again authenticate her date of birth, enter that PIN, and then the comparison that she sees will look exactly like what we just looked at together. She'll see both plans laid out side by side, have the same tabs on top. It will have the option, if she's self-sufficient, she can enroll herself. If she uses that, you will get credit. As long as she uses that email that you sent, it will be your sale. She can also download those documents for star ratings, all of that at the bottom. So exact same view, all the same information we just looked at together. So let's say that we want to, we've had the talk with Betty. She is very excited about this Aetna plan. We are ready to get Betty enrolled. So we've gone through so many different steps, but it is time to make it happen. I'm going to click on this button to enroll, and that's going to take us to our enrollment form. Betty's name was already populated here, so I'm just going to go through and just fill out some of the demographic information here. Of course, you'll just fill out whatever is appropriate for your client. Normally, our date of birth does carry over here. This is just kind of one of my demo account little things that doesn't always work, but that should be already listed. Again, we have the email address here. I'm just gonna, let's see, 212 Broadway in Newburgh. All right. If there's a different mailing address, we can add this here as well. Now we have the blue button here to continue to the next. Oops, I got a little error message. My bad. Need to put this in the appropriate spot.
You have Betty as a male. Does that make a difference?
I didn't look, I'm sorry.
I just want to make sure.
You do want to select the correct one, yes, because any incorrect information, you might get requests for information from the carrier. In the demo here, I'm sorry, I wasn't paying that close of attention, but good call out. Yes, you do want to select the appropriate one. So then we'll continue. Again, we'll add our Medicare information. Then we have provider information. Do you wish to specify a primary care physician now? If we select yes, we can go through here. We can see that anyone that we have listed here is not a provider under this Aetna plan. We can do a search for another doctor. Maybe Betty says, hey, I want someone that's just going to be covered. We can look that up. if you do have a provider that is covered by the plan, you can just select the option and designate them as the primary care physician. Then we have language preference. We have English or Spanish. Now notice, we have a note here to call Aetna. This is if there's a language that is anything other than English or Spanish. You will need to call them directly if you select other here. Now, if different carriers will provide different information, so some of them may have languages available, some of them may leave you a note. So just want to call out that little feature there. Let's see, bear with me one second. We're going to pull up a number here.
I can drop one in the chat for you, Ed.
Thank you.
Yep.
Thank you much. All right, then continuing on. Then we will get to our list of options here for eligibility. Now, this is a long list. Now, remember, Betty does have the option to enroll herself if we have emailed that comparison to her. So this can be very confusing for your clients. So what I would do is read through the list, select which one is appropriate. I would just copy and paste it and send that to Betty directly so she knows which one to pick from this list. For this one, I'm going to just leave it this one we're currently on. I'm leaving employer or union coverage. And then if we scroll down, we'll ask for the date of the event. So whenever that changed. Then we have a few more additional questions, just kind of basic questions about spouse, Medicare, Medicaid. These are just straightforward, ask the question and select the appropriate answer. Then we have payment method. Now this will be different depending on the carrier. They'll give you different payment options. We can see with Aetna, we have a monthly bill, we have an automatic bank deduction, deduction from Social Security, and railroad retirement reduction. If I select automatic bank account, we can enter ACH information here. Some carriers might not give you this option. Just want to call that out. You might need to give them a call. They may give you other directions. Aetna will give us the option to just enter that bank account information. For this example, I'm going to keep it easy and just say we're going to keep it as a monthly bill. And then we'll just click on continue. Yeah, let's see. Oops, there we go. Then we're at the end, we can review the application. And I do recommend going through, making sure the info that's been entered is correct. It's only going to help you avoid getting your application declined or an RIF, or RFI, request for information. So I would just go through, review the details that we added. Now there is the agreement. You must read the disclosure below and check the box to confirm you have done so. So you will want to go through this, read this with your beneficiary, or they will read it themselves if they are enrolling themselves, and they will acknowledge that they have read the agreements here. Then we'll ask who is signing. Is it the enrollee or the authorized representative? Then we have the option for an e-signature in person. We can just have Betty type in her signature here. We also have the option to use the signature pad. Mine never looks right. Then we can also send that as an email. We say customer on the phone. You may want to be on the phone, but you can send that as an email or text message using the options below. And then you can have that conversation with Betty as she's looking over that enrollment application. But let's say we're doing an e-signature right in person. Again, it's just as easy as typing in the name. Betty can just key that in. Then we can submit, and then we will see that we have the application processing, and then we have our enrollment all done. Now we can email a confirmation. We can save this as a PDF with the options here. Now notice we have that Start HRA button. This is a great example using Aetna. We have this little circle here with an eye. If I click there, I can see different carriers, and it tells me how much time I have to finish that HRA. Aetna's only 60 minutes. Humana, 30 days. Huge differences. So make sure you are jumping on those HRAs in time. So we can use the button here to start the HRA. I would highly suggest that for Aetna. It's a one-page carrier-specific HRA. You can just go through, answer the questions, and submit it using the Sunfire tool here. Now, if there is a plan that you enrolled where the HRA is not integrated into the Sunfire tool will redirect you potentially to the carrier portal, wherever you need to do that HRA. So some of them you can do in Sunfire, some of the carriers want you to use their other system. So just want to call that out as for you as well. So we have submitted that plan successfully. Now I'm going to refresh, but essentially Sunfire is going to carry over that plan right over into Betty's contact here. I see it's pending with an effective date of September 1st. And then I see that her status has changed to enrolled. Enrolled means that she has done exactly that. We have her enrolled in a plan, but we have not hit the effective date yet. When that happens, the status will change to active. I'm, for example's sake, just going to alter the date of the plan here, and we can see the status is now changed to active. Betty is now an active client, fully enrolled in an active plan. So let's say at this point, Betty, or after some time, Betty gets in touch with you and says, hey, I have this astronomical bill. I need help with it. Can you make a call to doctors, carriers, et cetera, et cetera? You will frequently be a go-to person, and these issues can take a lot of work and a lot of time. So we have a team here that will help exactly with these different queries. Our client services team will take care of all this footwork so you can concentrate on your business. In Betty's contact here, we also have the tab that says support. I can come here. I can see if I have any support requests that have been sent to our team, but I'm going to just click on an example here and or create an example here for us. But we can submit a request to go to our team. We can see Betty's information is already populated. I'll just click on continue. We'll say that she has a billing issue. You may have more than one policy entered. That happens. You may see that in the contact. We just have the one, so we will select that Aetna plan. And now that we are here, we can enter examples, or we can enter the details rather of the situation Betty needs help with. So here I am just going to enter in a little example I have ready to go. Betty basically needs help with a big bill that she received. So we can be very specific in what we're asking our team. Betty visited the doctor last month, received a large bill they thought should have been covered. Please confirm the billing code with the doctor's office. Once that's confirmed, please conference call with the carrier and the client to confirm if the bill is covered. Then we can get additional details as well, anything that's going to help our navigators. So we can say, client uses a walker. You may need to call 2 times. Then we'll send that to our team and they will start working on this ticket within 24 hours. We shoot for 3-day resolution. That can vary depending on how complicated an issue may be. Another thing, our support team is bilingual, so they will be able to help your clients in English or Spanish. Remember, when we entered the contact, we could select a language. So if you selected Spanish, this will go to a Spanish-speaking associate here as well. And all of our team members here are not licensed. So what that means for you is if Betty starts saying, this coverage is not working, and she starts expressing anything that may sound like a sales conversation, we will always refer Betty right back to you. We are not licensed to have that conversation. We want Betty to stick with you, turn to you as that go-to person. How we doing, John? Do we have questions? Anything else I can answer for now?
I think that covers it.
All right. Now we have so many more resources to show you more things about the platform and the different tools we have. So we will have more to share, but that I wanted to at least show you using some of the basics, getting information entered and carried over to that quote and enroll tool.
Wow, what an amazing training. Thank you so much for giving that to us. I know there's probably going to be a lot of questions. I know we're already running a little bit over our hour that's scheduled. So I'm going to say thank you right now for doing an amazing job on going through the platform and going through how to add a client, all the way through how somebody can get enrolled. So that was wonderful. For those of you on the call, if you have questions on any of that, this is all being recorded. So you can always go back to the recording on the LBA website, take a look at it, and we can really go from there. I will do some follow-up trainings on some specifics, and I might even have a couple of questions for you, my friend, but I'll touch with you offline. So we're going to get close to the end of the meeting, but before we do that, I wanted to invite Gabriel back onto the call so that he can go ahead and give out his big announcement that he wanted to do at the end of this. So Gabe, are you on the call with us still? Are you ready to go ahead and start speaking with us?
Yes, can you guys hear me okay? Everybody can hear me?
Good to go, brother.
All right, perfect. Okay, guys, so let's go ahead and get started here on the big announcements. I am going to put in the chat. We'll open it up. I know it's past the hour, so we apologize, but if you want to stick around a few more minutes, hear the announcements, and we'll stick around if you guys want to ask Charlie or John any questions regarding the platform. But the big announcement is this: we've been hearing all of the agents asking about leads, right? How do we get clients? How do we get things going, right? So officially, we wanted to launch now that we have an incentive program for everybody here on the call that gets appointed. So you got to do your AHIP, you got to do your certifications, you got to get appointed with the carriers and get set up with at least 2 carriers. And I always let everybody know, focus on getting set up with 2 companies. That's all you really need to get started. And as you get more seasoned within the Medicare business, you can always add the other carriers later on. Okay, but this is like insurance. You know that there's 50, 100 companies out there, but you always end up using the top 2 or 3. Works exactly the same. And we have a link that you could look through your Spark platform if you want to check your area, your state, and your city, and it'll tell you what carriers are going to be the best ones to get appointed with. So if you knock out your AHIP, you do your certifications with 2 carriers, and you're ready to sell, we're going to give you $500. Okay, you're going to get $500 to spend on any lead system that we have to offer. And Sam, are you there? I'm going to have you talk. Awesome. Can you just go over the options with them really, really briefly as far as what we have for leads and what they could do with that $500? Just very briefly. Thank you.
Absolutely. Do you want me to share my screen?
Yeah, absolutely.
Cool. All right, and so here's what we have put together as a supporting mechanism to all of you. So what we have here is just kind of like a general overview of our lead options for anyone that wants to kind of start getting their Medicare engines going leading into AAP. What we've done is effectively made it the most agent friendly that we can possibly make it. And thank you for Gabe for kind of giving us the push there, and frankly opening up any option for you to purchase leads from. And so I'm going to kind of quickly walk through our recommended vendor list, but just to highlight 3 below here, White Glove, Medicare Express, and then a few others, LeadStar, Dialpad, NextGen. These are 3 of kind of our favorite vendors. White Glove being one that's really unique, in which they'll actually help set up seminars for an agent to give presentations in person, whereas Medicare Express is one that'll actually set up one-to-one in-person appointments for any agents. Both White Glove and Medicare Express a bit more expensive than some of your other lead vendors out there. However, the quality of the lead usually much higher. Others that are kind of again in the mix here, LeadStar, as I think that you guys may be familiar with, Dialpad, NextGen Leads. These are all leads that kind of like source prospects similarly and can kind of transfer leads over through a call or even from a data perspective, in pretty similar budgets. And just to kind of like give you a full view of what the lead list looks like, and you don't necessarily need to be restricted to this list at all. These are just some options that we're providing you. But again, we have a few here that are RGI, Lead Heroes, Lead Concepts, Datalot, Medicare Express, Lead Response, a few social media ones, different types of email vendors, etc. Take a look at this. Happy to share more perspective. Again, the focus here is to give you guys the most amount of flexibility to source and purchase leads wherever it makes sense for you, depending on kind of how you do business. But again, happy to be a resource to you and the LBA team to kind of push you through this journey.
Awesome. Thank you, Sam, for sharing that. So there is a lot of options. Literally, you have all the lead options available to you now, and we're giving you money for $500 to get started and kick off your Medicare business. I mean, this is amazing. I hope everybody sees the power in that, and you're going to take immediate massive action and make sure you do your AHIP certifications and knock it out. So again, 2 carriers, AHIP, get certified by October 1st, and we're going to invest in you. Even before you've even produced anything, we're going to give you $500 and you're ready to sell. Then on top of that, it gets even better. Okay, like better, right? I'm going to share that for any prospective clients that you write, a new to Medicare, right? On top of that, I'm sharing my screen here. Can you guys see my screen? You're going to get an additional $25 per enrollment for all carriers in 2024 effective date. So when we have open enrollment now coming up, for any new clients that you're going to write and you're going to get paid on, right? You're going to get your full commission. On top of that, we're going to give you an extra $25 to reinvest in your Medicare leads or business and continue to grow your practice and continue to make sure you're heading in the right direction. So $500 up front. When you start closing business, we're going to continue to give you $25 per enrollment. So awesome, guys. Let me see. Sam, did we miss anything out on the lead side? I want to briefly open it up for questions. If anybody has a question, go ahead. Yeah, just unmute yourself and go ahead and fire them off.
I have a question. So I just want to get clear. So on the street, we get 611 for new, plus we get upfront 500 for leads. And then whatever we close, we get additional $25 on top of that.
That is correct. Yeah, we're going to invest in you an additional $25 for every single new Medicare client that you write.
And we also get 300 301 or 311 for residual?
You get a 301. It actually just went up for 2024. Sam or Carl, you guys know what those numbers are for 2024? It actually just went up right now. Sam, do you know the amount?
I believe it is now
It's like 611, right, or something like that. It went up to 611. And by the way, California, New York is a little higher. It's like 750. So you get essentially half renewals for the rest of that client's life as long as you keep them in the books.
So if we get licensed in California, I'll be on that California Medicare platform.
So if you are in California and you write a client in California, you get paid a higher commission because California, it's its own unique beast, right? I mean, they have their own kind of play by their own rules, but the national average is going to be around 611, etc.
And can we get non-resident licenses?
Yeah, absolutely. Yeah, I mean, we're licensed with almost all the states now. I forgot the total, but if there's a state that we're not and you need it, let us know. If you have a piece of business to write, we can go ahead and get set up there. Okay.
I'm ecstatic. I'm a licensed agent, so I'm like, all right. I'm just like, okay.
Excellent. We're fired up. I'm going to give you $500 right now in your account in your Spark platform. I'll show it to you here. Sorry, guys. Let me show you here my screen. I don't know if you could see that or not. Hold on one second, guys.
Abe, do you want me to share my screen? I can kind of walk
it's
through
right
it
there. Can you guys see it? So you'll see it in your Spark platform. Anyways, we can get more into that, but it'll be tied into your Spark account. So, all right. Any other questions, guys? I don't want to hold you up too much. As you know, these are huge announcements. This is really important. It's going to really help you guys get going, but we want to be respectful. We are recording this, so we're going to upload it to our YouTube channel. Make sure that you go to our YouTube channel and register if you have not given us a like, and you will get all our notifications, all our future trainings, etc. Okay. So any final questions, guys, before we get going here? I'll take a couple more questions and I'm going to wrap it up here.
Can you drop the link, the YouTube channel link on the chart?
I'm sorry?
Can you drop the YouTube channel link on the chart?
Yes, yes, I can. Give me 1 second. Everyone in the meeting, here we go. Just click on that and you can register for the LBA YouTube channel. We have all of our trainings get recorded and uploaded there.
I do have a question for you. All of those is for people who are already getting started. Let's say that I hear that information for the first time and I want to know what to do. What are my steps?
If this is your first time hearing it, you're saying?
Yes, from this platform. What do I do?
Just reach out to us at support@legacybenefitsalliance.com. Send us an email. We'll reply back and we'll give you step-by-step instructions on what you need to do to get started. Okay.
Support and
yep, I'll put it in the chat. Or Carl, can you do me a favor? Can you put the our email there, our support email? All right. Any other questions, Erica?
Hey, good afternoon. Do you have the price for the first 2 leads that you mentioned? Do you have the price for those?
You can reach out. Sam, I don't know if you have that information. Every lead company is going to be a little bit different. So if you want to have more specifics on that, just reach out to Spark and we can get you some pricing and we could talk to you more in depth about each of the programs that you might be interested. So you guys know one of my personal favorites. It's direct mailer by Lead Concepts. I'm a big advocate. You can pick a zip code in your area. We'll do a mailer, and then you can have people come to your office, or you can host at a library or local place, and you could pack the house with 25, 30 people that are all qualified, turning 65, and they're ready to get things going. So that's my personal favorite. I've seen a lot of these different lead star, lead gen, all these different things, but in my opinion, the direct mailers are very, very effective. But reach out to Spark and they can guide you and customize that for you. Anyone else?
One more question. Hi, how are you? If you're ready to sell right now, so what are the incentives? Are you giving incentive?
Yeah, if you're ready to sell right now, make sure you're set up with the Spark platform you have your AHIP, you have everything knocked out, we'll get you taken care of. We'll give you the 500 and we'll get you going.
Get it going.
All right.
All right. One thing you guys did not mention for the recording for CMS. How do you go about that?
That's all built into the platform. So you're able to use that feature when you're enrolling if you need to do that. There's a lot of different options. You
Okay.
can go on our YouTube channel. We actually do a full-blown Medicare Sunfire tutorial, okay, on there as well. So you can absolutely do that. Okay, and watch the video.
I want my $500.
All right, reach out to us. We're here to help you.
Miss, is there any phone number for support? I know that you provide an email address. If I want to have a conversation, who do I contact?
Yep, I'll email the support and we're going to send you all that information to help you get started. You'll have all the contact numbers and everything on there, okay?
Awesome, thank you.
You're welcome. All right, guys, is that it? Well, you got me here in color. Ready? 1, 2, 3. No more questions? All right, guys. It was great seeing everybody. Look forward to working with each and every one of you. Take care. We'll chat. We'll see you in the next 2 weeks for our next training. Bye-bye.